Hi, my name is Fidelis Wangata from Kenya. I've been in India for the last week or so. Came here with my father-in-law and mom-in-law. My dad-in-law was diagnosed with prostate cancer, and we thought that we would reach out to India to seek specialized medical attention. My father-in-law had a routine medical examination, and that's when it was discovered that they thought he may have prostate cancer, and so tests were ordered to be able to confirm with certainty that that is indeed the case. And a couple of tests were done. I think there's one for PSA and another for biopsy, and the results confirmed that it was indeed prostate cancer.
Walter came to me as a diagnosed case of metastatic CA prostate. It was stage 4 prostate cancer. He was already treated back in Kenya with Zoladex and hormonal. Zoladex is nothing but LHRS agonist, and that is almost, there's a drug used to suppress the testicular function. Basically, the prostate cancer depends on the hormonal milieu that is secreted from the testis. So we have to either suppress it medically or take it out. So he was already on these medications, and the patient progressed on these two medications. Subsequently, he was given chemotherapy. So post 3 cycles of chemotherapy, patient again progressed and had a lot of pain, for which he received radiotherapy back in Kenya.
As my father-in-law's condition progressed, we had been considering various options for treatment, in addition to the treatment that he was receiving in Nairobi, Kenya. And following research online, as well as talking to a number of friends who are in India, we had identified India as one of the potential areas or countries that we could look to. And so we had been doing a lot of internet research, reached out to a number of facilities and hospitals and doctors, but it is quite difficult to decide. India is a huge subcontinent. There are lots of specialists, lots of people who could possibly have been helpful, and so deciding as to the ideal hospital, the ideal specialist, that was going to be very, very difficult. So when we were speaking to a couple of hospitals, I asked to speak to a number of patients, especially from Kenya, who had used their facilities, and I came across the profile of Elijah, who was very, very helpful in immediately recommending that we talk to Doctors Beyond Borders. Doctors Beyond Borders immediately took over in helping to manage every aspect of the trip with respect to potential options of hospitals, specialties, specialists themselves as well, and logistical elements such as visas, as well as what else we need to do for vaccinations, and the very basic things, the T's and the I's, crossing the T's and dotting the I's, make sure that everything was done properly. Everybody have been absolutely marvelous, from being very responsive on emails, answering questions very comprehensively, but above all, you get the sense that the patient care and the needs of the patient and the needs of my father-in-law are what is paramount and what they were looking out for. And of course, as you know, it's entirely free. They have been absolutely marvelous, and I couldn't recommend them highly enough. My parents-in-law have been absolutely delighted as well, not just for the fact that everything was taken care of, but also meeting them in person, from arranging meeting us at the airport, but also throughout, whether it was the bookings for the hotel, which was excellent, and we'll talk about that shortly, or arranging with the actual doctors and the facilities at the hospital, and the logistics from point A to point B. That has been absolutely marvelous.
Walter came to me by Doctors Beyond Borders, diagnosed case of metastatic CA prostate. It was stage 4 prostate cancer. With this history, he came to my cabin. After evaluation on bone scan, he had multiple bony lesions, and MRI showed multiple bony lesions, but did not have any cord compression. So hence, patient was largely asymptomatic at present. And I gave him options that as the patient is largely asymptomatic, though he has a high burden of disease, he has a poor tolerance to chemotherapy in his previous exposure. So going back to one more chemotherapy called cabazitaxel will not be a good option in this. So hence I put him on one more hormone medication called as abiraterone, which is approved worldwide in this category, that is post docetaxel failure.
So Dr. Chandra Gowda went through the entire medical history of my father-in-law. He reviewed the medical reports that we had sent through, but more importantly, he was prepared with a new eye and a new fresh mind to consider his state as he is today, and to order fresh rounds of tests so that he could make a decision or recommendation on the line of treatment based on current evidence. So he ordered a number of tests, which we did, and it was amazing that BLK and the International Patient Center and Doctors Beyond Borders were able to help us to get all those tests done from mid-afternoon till evening, a battalion of tests, and then to chase up to ensure that the results were immediately available, so that the following morning we were able to go back to the doctor, who was able to analyze the results and to immediately make a recommendation on the proposed line of treatment. It was incredible that he was able to immediately evaluate and say, look, given where your father-in-law is today, given how he's feeling, we think that the management of the case through medical oncology is still the appropriate way, and we are confident and hopeful that what Dr. Chandra has recommended is the best way forward for my father-in-law. And more importantly, my father-in-law has confidence in that and is pleased and happy about that.
We should assess the patient in total. We should consider patient complaints, we should evaluate the disease, and accordingly sit down with the patient. There are options available in the internet, in the guidelines, but the doctor, treating clinician, should assess the patient's problems, should assess in person. It's very important. You should assess the patient's problem in person, evaluate in a right way, and use the guidelines in jurisdiction to the patient's complaints. So that's what we did it, and the patient is happy.
We found that the technology, the medical facilities, the medical staff, top notch really, and everybody was so helpful, always smiling. Doctors Beyond Borders have made our journey here to India and in India and throughout incredibly easy. If we had continued as I had begun, based on personal research only, India is a massive subcontinent, and therefore it is really difficult to identify the right facility, the right hospital, the right specialist, and the right care, and also the right cost. And so I would suggest that doing this on our own would have been not necessarily impossible, but extremely difficult. It would have been much more expensive, it would have taken far longer to do, and logistically it would have been a nightmare. But Doctors Beyond Borders, the operational staff led by Ekant Sharma and his team, have made every single step of the way a walk in the park, from the logistics, from organizing what is required for visas before we traveled, the sort of vaccinations that are required, the accommodation, which was really good, affordable, and right next to the hospital, to the selection of the hospital itself, the facility, the consultants, and to being present and to meet with us, as well as to meet with the doctors, so that they can provide that succor, so to speak, that extra level of scrutiny of what was happening. We always felt that we always had another member of the family, a competent member of the family, a knowledgeable member of the family present with us. And they really helped Doctors Beyond Borders too. Also, in addition to identifying an excellent specialist, Dr. Chandra Gowda, who was marvelous to us throughout, but also in managing and minimizing cost so that it's affordable for all of us. And on the whole, even though of course we have a patient, but it has felt not as difficult and has not felt as painful and has not felt as challenging as could otherwise have been. And therefore, I can only say on behalf of my parents-in-law and myself that we are extremely, truly grateful to you, and long may Doctors Beyond Borders live. And we pray that you'll continue to be of assistance to lots of families out there across the world. Thank you so much. Really appreciate it.